So tonight, I just want to welcome Mara and Dr. Fletcher from the rehab at Hospital of Dauphin County in Pennsylvania. And we are excited that they are going to talk to us today about some of their work with the piezo wave and the TMJ joint. So thank you for your time and thank you for joining us, Mara and Dr. Fletcher. Let's hear some of your good news.
Awesome. Thanks for having us. We appreciate it. So we're gonna focus on the use of shockwave to treat TMJ. This is my big kid. He doesn't have TMJ as far as I know, although maybe I should have Mara evaluate him. But he's a hip dog. And then here's Mara with her TMJ dog, Jethro. So you'll see a little bit more about him here shortly. But she and I have been a rehab team since the beginning, she was rehab before I was, but as far as practicing with a previous practitioner. But I've been a vet for 14 years and doing rehab for almost 7. And Mara's been with me the whole time. So we have blazed trails together in our team, and we blazed this trail recently because she had treated her dog, but we had yet to treat a client-owned patient. So kind of a background on TMJ, which there isn't a ton of information out there, but we're focusing on the joint where the mandibular condyle joins the base of the zygomatic arch. This joint is essential for their ability to chew, bark, any other jaw movements, play with toys, chew toys. Bite dogs, police dogs are going to be actually pretty greatly affected with this and probably are grossly underdiagnosed with it. But it causes pain and dysfunction with these guys, and it can be pretty debilitating. So just kind of an anatomy review of what we're focusing on, but you can see at the red arrow, there's the condylar process of the mandible. The blue arrow is pointing to the mandibular fossa, which is where we aim the shockwave into that area there. So that's our focus. And then we also trace down the pterygoid muscles and then the masseter muscles, but we'll go into more detail. But just to kind of give everybody an anatomy review of where we're going to be focusing the treatment. So the muscles involved are masseter, which is our main muscles for chewing, the temporalis, which is one of the dorsum of the head, and assist with closing of the jaw. The pterygoids, which are underneath the mandibles, are a focus on jaw movement and stabilization. And all of these are affected with the dysfunction in the joint itself. All of these muscles are affected compensatorily, and that's where a lot of the pain arises as well. I have TMJ problems, and I can tell you it's in Martis as well. It's debilitating. So I can't imagine a dog not being able to vocalize what they need to have fixed. So the muscles are really key in the treatment of this. Trauma can be affected. So if the dog has any sort of like hit by cars and then affects their jaw positioning. Arthritis can be secondary to any sort of dysplasia within that joint. Like I said, bite dogs, so overuse, police dogs that work on bite work or Schutzhund trained dogs are going to have probably problems with this just from overuse. Obviously, it causes pain. They may drop food out of one side of the mouth while they're eating. That can be a symptom. Chattering of their teeth, vocalization when yawning is another thing that owners may know. And it may present as maybe a dental issue. The owners might think there's something wrong with the teeth. And so even as a GP, I would say TMJ is certainly, before rehab, TMJ is certainly not the first thing I would think about. If an owner would present to me with difficulty chewing and having more, I think of more of a dental issue. So physical exam, generally, this is more of a historical sort of thought process. So you're going to go based off of the history the owner is giving you that may lead you down to this might be a TMJ problem. You may feel, if the dog lets you palpate in that area, you may feel tension in the masseter muscles. and they may not like you there as well. So they could be head shy, not letting you. But if they yawn, do a stress yawn in the exam room, and they have trouble doing that or tilt their head, that can give you an idea. But there's very few physical exam findings you're going to find besides maybe muscle tension. Radiographs are generally normal, unless it's pretty severe. These have to be sedated to get proper views. But CT scan is going to be your diagnostic of choice. MRI is a close second, where you'll be visualizing the muscles, but CT is going to be a little bit more of a diagnostic of choice for these. And as we know in veterinary medicine, we can't always do a CT. So sometimes we have to treat treat the treatable, as I say. But and rule out any sort of like cancerous process in the meantime in that area before we put a shockwave on it. So conventional treatments, sure, NSAIDs, or corticosteroids, obviously not at the same time, can be considered prior to us having a shockwave, massage, jaw exercises, and laser therapy. So this is an image of, sorry, N of 3. I stand corrected. We have 3 TMJ dogs. This is Maeve. She originally presented us for post-op rehab of a TPLO and has never left. There's always things that we're treating her for. And she has TMJ symptoms. And that's where Mara doing laser therapy on her. So this is prior to us having shockwave. You can get that joint injected. I have not attempted that though. So don't ask me questions about that, but supposedly you can inject that joint. But all of this comes at a cost of PRP injection to the joint that you need to find someone who's willing to do that. And Mara is probably going to make me do it at some point. But there's cost to a lot of these things, and then recovery time, and then efficacy concerns too. We want these dogs to be comfortable and able to at least eat without pain. So Shockwave gives us a really nice resource because it's non-invasive. It is extremely focal to the area that we're wanting to treat, reduces pain and aids in healing, and it's a faster recovery than laser therapy can give us. It's less invasive than joint injections. So for us, with a particular patient we're going to highlight, it was our treatment of choice.
And so when we got presented with using the shockwave, we were trying to find values on where to go with it. So we looked in some of the human medicine, and this is one of the studies we found. They compared 2 different types of treatments, and shockwave was one of them. The shockwave that they did in the humans, they did it once a week for 4 weeks with 1,000 to 1,500 shocks of energy with an energy flux density of 0.15 millijoules per millimeter squared. And found that the shockwave had improvement and longer lasting effects compared to what they did as the ultra short wave therapy. So we kind of used this study as a starting point for what we did when we did it in our patients. Obviously, when you're treating dogs, you may need to sedate them for the shockwave only because you're working around the mouth. So you're going to have to go with temperament on the patients you're doing, and their pain level as well. We did it once a week for 4 weeks in our cases. Our doses were 1,500 pulses. The human studies, like I said, that set up to 0.15 millijoules per millimeter squared. We never got that high with the dogs, but that's the aiming goal that we were going towards. But we kept it to where that they were comfortable and they could be awake for the treatments. So this is my dog getting his. So you can see we're starting with it over the joint itself. We did 500 pulses right to the joint itself. And he's super relaxed during it, no discomfort. When we start treating the muscles, you're going to see him, especially under the jaw, we get some nice soft lip licking, and then his eyes start to relax. So he has a lot of tension underneath of his jaw is where a lot of his problems come. So we did another 500 pulses around there, and then we're going to move and do about 500 on the masseter muscle as well. And we treat both sides. So once again, everything's about like the comfort for them, and then going along with trying to get as much energy as you can with them being comfortable. So
All right, so our case study was Copper. He was an 8-year-old male neutered Irish still is an 8-year-old male neutered Irish setter, and he presented to one of our other doctors in November for inability to close the jaw after yawning, and he would yelp when he would yawn. Originally he did have otitis, so they thought maybe that was a pain in the auditory canal, the eustachian tube, and maybe that's what's triggering the pain when yawning. So they treated him for that. And a dental was recommended in case there was an underlying dental issue, and the owner declined. After 2 weeks, they elected a Rimadyl trial because they hadn't seen any improvement. And a week after that, sedated radiographs were performed because nothing had, the owners weren't seeing any improvement. And it was kind of prior to this point that our vet approached me and then also Mara about, could this be something else like TMJ? And I said, absolutely. And she's like, was there anything that you could do for it rehab wise? And I said, Mara's been itching to treat another dog with shockwave for TMJ. So send it our way. So she wanted to get the sedated radiographs performed first. And she did. And when the patient was under sedation, we talked to the owner about shockwave. And she was fine with us at least starting with one treatment. We did recommend to pursue like a CT as a diagnostic step, or potentially work up the dog for masticatory and muscle myositis, but that was declined. So we were going based off of treat the treatable. The radiographs were not abnormal. There were really no significant findings there, so we felt comfortable treating. The first session was done when the dog was sedated. So we applied 1,500 pulses, similar to what the video just showed that Mara was showing. And we did a density of 0.073 millijoules per millimeter squared. Owner reported a little bit of soreness the day after, but this was at the same time as the sedated radiographs, and we're doing like open jaw views. So it could have been from the manipulation as well. The second session, we decreased the energy density flex to 0.048, just because he was awake and we weren't sure how he was going to handle it completely awake. And he did fine with that. And so we went back up to the original energy density for the last 2 treatments. And then Mara did massage manual therapy to the masseter muscles for 5 minutes on each side. And by the last session, the owner reported Copper was starting to be naughty again. So he was back to getting the trash, stealing things. So he's doing jaw movements and picking up items with his mouth. And he was no longer yelping. So vocalization had stopped. But she was still seeing the chattering after yawning. So there was still some discomfort there. I mean, it wasn't a complete cure, but he went back to essentially his normal life before that.
And with him, we said he could continue for the full 6 treatments, but she was happy with the results at 4, so she stopped at 4. So
Yep.
This is just a video to kind of go over how you can massage the masseter muscles. Once again, they can be relatively sore, so you should know your patient that you're working with. You should be comfortable with them and be aware that you are right next to the teeth. So if the patient tries to move away or seems like they're uncomfortable, you should make sure that they have space to be able to move away from you, so you're not injuring yourself or getting them concerned. But just slow, gentle movements, working up pressure to have them relax, to rub over the masseter muscles itself. The other part of it that you can do is go internally, which my dog actually likes more, which is weird. Most dogs probably wouldn't always tolerate this, but you can see his eyes start to droop. He gets very doughy. This was one of the first things when I was taking a manual therapy class and tried it on him. I'm like, I think my dog might actually have TMJ because he's obsessed with this.
Yes. Yes, he really did like that.
Some of the other things you can do is suboccipital release. So the temporal muscles, there's a lot of muscles that connect in the back of the skull. So you try to get a couple fingers into that back area of the skull. It can be super sensitive back there. So sometimes some dogs require some gentle massage first before you try to do anything. When you start to put your fingers in there, you have your hand draped over the skull and just let your hand kind of fall and go with gravity to do a little bit of traction over that area. Most dogs will just start melting. We have even see it with a lot of senior dogs that have other problems too. A lot of tensions in the back of the neck. So
Yes.
Once they're out of pain, some of the things you can do are some jaw exercises. This is a super easy one. You put peanut butter on the nose and have the dogs sit there and try to lick it off, and that's moving the whole tongue complex to try to get some more motion of the jaw. That's a nice, healthy kind of motion. So
It's like a self joint mobilization.
yeah, like a self joint mobilization in a way. So okay.
That's our little synopsis. There's some of the studies that we looked into. So it's just kind of a quick review of a case, but yeah, N of 3, one was only laser therapy, or 2 were laser, one was laser therapy, 2 were shockwave. So
No, that's great. I am very interested in how so the one dog, there was a little bit of yelping. How does your dog Mara display that he could be TMJ?
Yeah, so I've been convinced he has it for probably 2 years now. He doesn't like eating hard treats at all, refuses all hard treats. When he eats food, he sometimes will fall out of the one side of his mouth as he's eating. He doesn't like to carry balls in his mouth. He doesn't like to carry bones, none of the things. He doesn't like to play tug. He picks up the bone and will immediately drop it like it's just too hard for him to carry. After we did the shockwave, 2 days later, he went in the trash, stole a big bowl of something, and carried it around the house. And I was like, wait a second, I just thought you were a good dog, but apparently you were just really painful. So
yeah.
Interesting. And do you think, or again, I'm going back to my last 4 months with Dr. Rivera. Do you think there was any other symptoms beyond the jaw, like all the nerves that pass by there, and any effects anyplace else in the dogs that you noticed?
I don't think so.
You pretty much see it in the jaw area and the chewing area and the
yeah,
mastication.
mostly
Yeah.
that's what I've seen, mostly the chewing. I mean, nothing else really seemed different in
Right.
either of those two.
Right. I'll be honest, I probably had a case of this a long time ago before I did rehab, and I think I worked up the dog for masturbatorial myositis because she was very painful, and probably missed it. I ended up putting her on steroids and everything resolved, but I think that was just, typical shot in the dark. But same thing. It was jaw chattering, refusal to eat. She was to the point of refusing to eat. But I did a full workup on her as far as like cervical rads and all this kind of stuff, and everything else was pretty normal. So
Interesting.
she
It's
was
hard.
kind of a
So
mutant golden retriever too, and she had a little bit of an underbite, and I wonder if her jaw conformation is what predisposed her to this. So
well, that makes you think of certain breeds for sure, right?
right, she's a mute. I mean, she's the weirdest looking golden retriever you'll ever see.
Yeah.
So
Do you ever
Interesting.
notice neck pain too?
I mean, that's part of like the doing the release on the back of the neck, because
Right,
there is
right.
definitely some connections back there with all the muscles that connect there.
Mhm,
I don't think the ones that we've had haven't had it that bad at that
mhm.
point,
right.
Yeah.
but I could see that there's neck involvement.
probably
I know with mine,
potential.
my neck hurts when I'm really bad.
Everything
so.
hurts. Yeah.
Yeah,
Everything hurts.
yeah, I have it
Everything.
really bad too.
Yeah.
Really bad. Mm-hmm.
I did when I used to chew gum, and I stopped chewing gum, and
Yep.
Yeah. Yep.
Mm-hmm.
that definitely helped. So
Mhm.
That's why I
interesting.
think you have dogs that like constantly want to chew on their hard bones and all of a sudden suddenly stop, or changes in their behavior can lead to having some of these kind of problems. And I think people miss them because of that.
Mhm.
For sure. Well, I mean, I know it's a big thing in horses that we watch for
Mhm.
because of bridles and stuff. So it's different for me to watch in a dog because they don't normally, they don't wear bits.
Right.
Some,
Right. But the
but
police dogs, like you just wonder how many of them are out there that are retired because they they don't want to do their job anymore. And it potentially could be because they have TMJ from what they've been doing their whole career. And, you know, sure, maybe they should be retired because that's causing the problem. But, you know, how many dogs are also working through that pain too, because they're trained to do what they're supposed to do.
Yeah.
So this could be a huge thing for like police forces to be aware of, that they should have their dog sure.
Or duck dogs.
Yeah,
I
yeah,
mean,
absolutely. Any of the retrieving
Yeah.
breeds, for sure.
crazy Shih Tzu dog, are they, that
The
they just,
Schutzhund,
Yeah.
yep.
and stuff,
Mhm.
that's, yeah.
And it
A
sounds
lot
like
of
it's underdiagnosed. So do you guys, I don't know if practice, I've noticed I've had to go to the doctors recently a couple of times, and I've noticed everyone has surveys. You always have to fill out all these surveys. Do they have surveys at practices, veterinary practices, that might focus a little bit on that? I don't know.
I mean, we use pain scales in our rehab practice that the owners fill out every time I do an eval and a recheck on them. And it's I always switch to the Helsinki pain scale, and it focuses on activities that the dog is eager, willing, not willing, you know, difficult, not willing to do it, all sort of thing. But it doesn't necessarily focus on that sort of aspect. But I do have a functional questionnaire that the owner fills out, and it says, is there any other concerns that you think, you know, might be going on with your dog? I kind of keep it a little vague at the end just so they can give me something else. But I think like they might use the words decreased appetite, and my vet brain goes to instantly to GI, dental, blah blah blah, and you have to maybe just switch that, just be better aware of the thought process, in my opinion, of this could be TMJ instead, especially the older dogs.
Yeah, I mean, with
Geriatrics.
Maeve, she came to us for a post-op TPLO, and we were just talking with the owner. She's like, yeah, sometimes the treats just like fall out of her mouth and her jaw locks up. I was like, that's not normal. And she's
Right.
like, yeah, I know. She's just kind of a mystery. I was like, no, like they can have TMJ too. Like,
Yeah.
that's an actual thing. She's like, oh, seriously? I was like,
Yeah.
yes.
Yeah.
So we were able to then kind of go and explore that a little bit more.
And owners have to tell you that this is something they're seeing. I mean, it's maybe underreported because it's underreported by the owner too. If they don't tell us, they're like, meh, I just thought they were old and they didn't like their food anymore. You know, like it's just, it's something, it's not their fault for not knowing either. This could be
Well,
job
and
pain.
vets too, because when I first said I think my dog has TMJ, I got a room full of just big stares like that's not a thing. I'm like, no, it definitely is. But then going into asking at vet practices, like, hey, can you take rads? Can you do this? And no one's super confident in those positionings either. So it's kind of watching the signs and seeing what that is. And we did have a dental with my dog, and it came back completely fine. So it wasn't a tooth problem. It was definitely a jaw problem.
Yep.
And obviously CTs are super expensive. What about, can you visualize that joint and whether it has fluid in it with a diagnostic ultrasound? I know we do that in the horses' necks. I'm just like,
I've never tried. That's a good question. I mean, I guess what is abnormal? It would be the question. Like what would that joint look like abnormally? And you'd have to get a good baseline of what normal. So you'd have to start ultrasounding a bunch of quote unquote normal dogs first. But that's a good thought. That would be a nice way to non-invasively do this and less expensively.
Yeah.
well, that's expensively, but also, I mean, at this point, Mara, can your hands kind of tell you when you palpate the TMJ if it's going to be sore, not just by reaction?
For my dog, yes, but some of them not as much. I mean, some of the dogs, like we've had questions on if they're sore, you start rubbing their jaw. I mean, in general, dogs relax in general with it if they like it.
Yeah, it's often a thickening.
Yeah.
Because I can feel it in mine
Yeah,
too.
like
There's
sometimes there's one side versus the other. Like my dog's, it's more his left side is worse than the other. Like you can feel those masseter muscles are like clenching down on the one side versus the other. But it's not as much as people where you have that full like clicking. Like I don't really get the clicking. I mean, you also can't get them to be like, open your jaw.
true.
Open your mouth and smile.
Yeah.
I wonder, I'm just thinking of my horse experience. If you put the peanut butter on either side, if they have a difference in licking to the side.
Right.
Right.
I mean, my dog refuses to do that exercise because he just doesn't like peanut butter. So that's why I had the other dog do that video for me. So
Yeah.
How
I
about
mean,
you?
it's like, really, you missed my mouth.
Yeah.
Right.
Yeah. He's
Totally.
like, I don't understand what you're doing.
Jethro's
today."
a little special when it
Yeah.
comes. He's a little bit of a.
I
He's
know
Well-
I know Dr. Taraka does that all the time for all of her gulp dogs.
Mm.
For
yeah.
the, you know, the licking the peanut butter thing, but I wonder to the side, if they can lick to the side. I mean, obviously the herbivore, the other difference we have between the horses and the dogs is the carnivore versus herbivore jaw action.
Yeah.
That's true. Yeah,
know.
a lot of more lateral movement in
Yeah,
Mhm.
horses. Yeah.
purpose of the jaw, if you're eating meat versus grazing.
Mhm.
So definitely something that would make a difference between the species, but
Mhm.
interesting for sure. And something it would be fun to look at the bite dogs more seriously with it, I guess. You
Yeah.
know, of course, they might want to bite you too.
Yes, that would be interesting to work on.
Yeah, the
They're
shits.
caged, a lot of them.
But the police dog should be handleable.
Yeah. I mean, that's
Um,
with treating this in general, you can't really muzzle them and do this
No.
either. So it's
Mhm.
going to have
Right.
to either be under a slight sedation or a dog that is amenable to it.
right.
Although I
Right.
didn't know like Copper at
Yeah, we
all,
didn't
and
know
he
him.
did really, really well with it. And he was a little bit of a nervous dog, but I find in general with the shockwave, most of the time once they realize what it is, a lot of them relax almost instantly with it.
Mm-hmm.
Yes. Yes.
I even
And-
have dogs more restless during laser therapy than I do shockwave.
Mm-hmm.
Well, and in the dosage, I'm not surprised you couldn't get that high, but I'm also not surprised that in general, the concept of getting really good results without a high dose
Yeah.
is getting more and more recognized. You know, I
Mhm.
just wrote up the comparison between Dr. Owen's shoulder dosage for a supraspinatus tendon and Dr. Tomlinson's shoulder dosage, and they're dramatically different but the end result was the same. It healed. Dog was functional for a very long time. For over, one was for over 18 months they were followed.
Wow.
Dr. Owens, you know, she used 0.06 millijoules per millimeter squared on a supraspinatus tendon and does on a regular basis. And Dr. Tomlinson uses up to 0.1 to 0.17. So that's a dramatically different difference to me in energy. At same number of pulses, pretty much all of that seems very similar, same orientation, same depth, things like that. We just don't know how much energy it takes to turn on mechanotransduction.
Mhm.
Right.
And I don't know how we'll ever exactly figure it out, but it's
Mhm.
one of my curiosities in working with this modality is
Mhm.
how much does it take to turn on mechanotransduction in different tissue?
Mhm.
So
And that's why we don't tell people exact protocols. We just make recommendations because there are a lot of similar results with different amounts of energy.
all different protocols.
Yeah.
And
So-
each patient can handle something slightly different as well. If they're more painful, they're not going to let you do it as high.
Right.
So they might have the same results as a higher treatment because they were more acute and it might be a little
Right.
different.
And the level of pathology is, going to dictate that dosage. Yeah. I mean, there's going to be no same patient. I don't care if it's a grade 1 supraspinatus strain. Those two patients still aren't the same. So.
yeah, and I think we all agree with that, but yet we still have we still have practitioners with the desire to have a cookbook.
Well, sure, that's what we are by vets. We like guidance. We like a formulary to tell us what we're supposed to do, and that's
But the values still
where
change because they
it becomes more of an
change.
art than a science.
They
so.
change with laser. They
is.
change with everything.
They
You
change
have
with
a
PRP doses.
if you have a cookbook, you have to also be willing to it's probably going to change at some point.
Improvise your
So
recipe,
don't
yeah.
get super comfortable with it.
Yeah.
Yeah.
So
That's
I
so true. It
totally
is an
agree.
art.
Mhm.
I love that.
The art is definitely true. I refuse to put videos online of like every single treatment for every single joint, because then people will say that's the only way to do it.
Right.
Well, and I found out the more we are doing it with the joints, like sometimes some dogs have different muscle compensations. So you don't want to just do the joint, but you want to cover some of the muscle too. But
Mhm.
each dog's going to be slightly different in that. You can do a shoulder joint and one dog has supraspinatus problems, but another dog has stuff in their triceps.
Mhm. Mhm.
Yeah,
Yeah.
and that's the rehab training that all the courses are
Mhm.
working on, but they're also different. I will say
Yeah.
they're all different, and they all teach you slightly different ways to look at the whole patient. But at least we're all in the same ballpark that you do have to look at the whole patient, and it's not
Right.
just
Yeah.
we're all in that ballpark. So that's
you're
a
right.
bonus
Yeah.
for sure.
And this was
Definitely.
great. I love the cases and the way you guys went over it. And I think seeing understanding the patient is great. It's really helpful. And then you can apply that information, to other patients, even they're all different. I love seeing the cases. So thank you.
Yeah,
Yeah.
thanks. Yeah.
No,
And
I
thanks
really
to Jessica
appreciate
for
it.
tolerating everything.
Yeah.
Being a demo dog.
Demo dog. We need lots of demo dogs in
He's the
the
best
world.
one.
Yeah. He's a little fluffy, so it's hard to see everything. But
Yeah, but he's devilishly handsome. So
Mhm.
Yeah, a greyhound is always an easier
Yes.
anatomy dog, but
Right.
it's okay. Thank you so much for spending the time and putting that together. And I think it will help a lot of people in the future explore different treatments for this. And
yeah, no, thank you. This was fun. It was fun to, well, if we get another crazy case, we'll let you know.
Yep.
Thank you so much.
we appreciate your time and effort, and give your doggies a big pat for being a good demo dog.
Yeah.
Will do, will
There
do.
you go.
You guys have a good night.